You know, schizophrenia, 1% of the population of our planet have diagnosed schizophrenia. That's not counting the ones of us that are walking around not even knowing we have it. And I got the opportunity to speak and meet Professor Elyn Saks yesterday, and she is a true hero, a pioneer, someone who had so much to lose by saying, no kidding, me too, I'm schizophrenic. But she did. And it wasn't that easy. Some of her friends said, if I knew that, I wouldn't hang out with you. But it's because of her that I feel like I can say that I'm Joey and I've got brain dis-ease, and my brain style is clinical depression. Elyn has had the honor of going to Yale Law School, graduated USC professor, and she's also an attorney, and maybe hopefully soon to be one of the advisory board, or no kidding, me too. Ladies and gentlemen, Elyn Saks.
Thank you, Joey, for that kind introduction. Didi, I'm really honored to get this Erasing the Stigma Leadership Award, both because stigma is so important and because Didi Hirsch is such a great organization. I have known of you for a long time and learned more about you recently, and was very impressed by the range of services you offer, not only treatment of symptoms, but housing and work. You see the person as a whole person with lots of different needs and not just a bundle of symptoms, and I think that's really good. I'd also like to thank my friends from my Psychoanalytic Institute for being here. Thanks so much. That's them. Friends are so very important, and I'm lucky to have some good ones. I'd like to tell a little bit of a story about stigma. In August of 1999, I was diagnosed with a serious physical illness. And my best friend, Steve, flew out from Boston to be with me in this difficult time. And as I answered the door, he reached to hug me and kiss me and smiled at me, as he always does. And looking past our embrace, he said, "You've gotten such lovely, beautiful bouquets of flowers." And at that moment, I thought to myself, when you go to a hospital for a physical illness, people send flowers. When you go to a hospital for a psychiatric reason, they don't. The stigma of mental illness is the belief that mental illness is fundamentally different from physical illness, that mental disability is fundamentally different from physical disability. This belief, in turn, is based on a notion that a person with mental illness is less than a whole person. No one would ever say that someone with a broken arm or a broken leg was less than a whole person, but people say that, imply that all the time about people with mental illness. My book, The Center Cannot Hold, My Journey Through Madness, is about how people with mental illness want what everybody wants, in the words of Sigmund Freud, to love and to work. Why is stigma so destructive? It hurts to have people make fun of you or even fear you, even if they don't know it's you they're deriding. Having a secret to hide never makes friendship easy. And maybe most important, stigma deters people from getting treatment. Many mental illnesses are treatable today, and people shouldn't have to suffer. But if stigma is a barrier to them getting care, that's a terrible result. Some forms of stigma go beyond feeling degraded and shamed. About 20 years ago, I found myself experiencing several severe headaches, and then one day I just stopped having any short-term memory. And my friends brought me to the ER, and then a predictable disaster occurred, which is they found my psychiatric records and they decided I was just having an episode. And this was the case even though my friends were jumping up and down saying, "We've seen her psychotic before. This is not that." I was sent home. I was just a psychiatric patient. A few days later, my internist sent me back, and eventually they did a spinal tap, and I was having a bleed in my brain, a subarachnoid hemorrhage, a stroke from which 50% of the people die. I'm glad I didn't know that, because I would have had a heart attack if I did. So what can we do to reduce the stigma of mental illness? First, people with the illness can come forward if they can do so safely. You'll see that we're your friends, office mates, co-workers, even lovers. Some people say that encouraging high-functioning people with schizophrenia to come forward is a futile effort because you're unique, Elyn. There aren't other people like you, and it's just not true. I'm doing a study with some folks at UCLA and USC on high-functioning people with schizophrenia, and we've got an MD doctor, we've got a social work caseworker, we've got some consumer advocates, full-time parents, full-time students. We are there. The stigma is just too great to come out. So the very stigma we're trying to bust is so great that people don't even make the effort to bust it. A second thing that might be helpful would be a more responsible media. To the media, when it comes to people with mental illness, don't sensationalize violence and contextualize it. Talk about the fact that being victimized is much more likely than victimizing, and that substance abuse is the real culprit for violence and not mental illness. And report our positive accomplishments, which far outnumber our violent crimes. Now, the best remedy for stigma, I think, is the most obvious: resources. I was diagnosed as schizophrenic fairly early on. I suffered from severe delusions. I had disorganized speech. For instance, I was on the roof of the Yale Law School having a breakdown and told my friends, are your copies of the cases being infiltrated like mine? We've got a case to joint. I don't believe in joints, but they do hold your body together. So those loose associations. In any case, I was given originally a very poor prognosis in England, and then when I came here and broke down, I was given, quote, a grave prognosis, which is the kind of psychiatric equivalent of a death sentence or a sentence to a bleak and painful life. Getting that prognosis means that you're unlikely to be able to live independently, let alone work. And that hasn't turned out to be my life. I'm a law professor, I'm happily married, I have a really great life. But mine's not the story of a lone woman who overcame great odds who through sheer force of will overcame great odds. It's a story of someone into whom enormous treatment resources were invested, both in the form of psychoanalytic treatment 4 or 5 days a week for years and continuing, excellent psychopharmacology, collateral supports like a support of friends and family, an accommodating workplace. The more we make good care available for individuals with mental illness, the more likely they will be to live up to their full potential. We need to commit to working with people and giving them appropriate resources. I note again the wonderful work that Didi Hirsch is doing in this regard. Ultimately, I think understanding and acceptance will follow. I have then been fortunate to receive excellent treatment. And so you can see why I'm so terribly honored to receive this award from Didi Hirsch, which again provides such high quality and extensive treatment and other services. Psychiatry and psychoanalysis have, in a way, been the star of my show, so to speak, and I owe my life to the ministrations of psychiatry and psychoanalysis. So thank you to all your mental health professionals in the audience for caring for us as you have been, for caring for us and for helping us to reclaim our lives. And to the non-mental health professionals who are here in the audience, thank you for supporting Didi Hirsch so that this work can be done. I'd also like to interject here my deep thanks to my psychiatrists and psychoanalysts, my beloved husband, Will, my good friends, Janet, Esther, Steve. So to conclude by returning to stigma, if you find a colleague or friend of yours in a psychiatric hospital, call and ask if you might visit. And please do send flowers. Thank you. Thank you so much. Thank you. This is a kick, huh?
Look, he's there now.